What happened to a madman's brain? Like what exactly is happening in a madman's brain? Like you used to know this person as someone who is normal, who was normal. All of a sudden the person start gallivanting, sigma-rolling, perambulating, going naked in the streets, losing himself, losing his sanity. What is that thing that happened in the brain? What is that abnormality? What exactly happened to the brain that made a person's health condition to change like that? Now, to be frank with you, nothing happened there. Everything is normal. So when you run a CT scan of the brain on that person, you will find out that everything is normal. The skull is normal, the brain is normal, the positioning, in fact, the hardware is perfect. When you run an MRI of the brain, magnetic resonance imaging, you will find out that everything is still normal. There is nothing wrong. There is nothing wrong. Everything is perfect. The nerves is perfect. There is no leaking blood vessel. There is no expanded nerve, no expanded blood vessel. There is no tumor anywhere. There is no water in the brain. So what happened? Why is this person now behaving like this? Why is this person running mad? Since everything, we have run tests and everything is normal. What happened actually? So what happened there is that the problem is from the mind. Madness is in the mind. You cannot diagnose madness. You cannot see madness. You cannot detect madness with any machine. The problem is from the mind. The problem is from the thought. Madness is in the thought, is in the mind. It's not the hardware. You cannot diagnose it. You cannot find it out. You may even diagnose tumor. You may even diagnose epilepsy, seizure. You may diagnose it and find out that maybe there is a leaking blood vessel somewhere in the brain, or maybe there is a particular nerve that expanded a little. That's why the person is that there is no free flow of sensation and all those things. But madness, you cannot diagnose it. You cannot diagnose madness. So that's why madness is more difficult to treat. In fact, a mad person does not need treatment because there is nothing wrong with him. I know it's sounding funny. There is nothing wrong with a mad person. Everything is perfect medically when you run an X-ray, a CT scan, MRI of the brain. Even EEG of the brain will not still dictate madness. The EEG of the brain can only, dictate the activity of the brain by telling you that this person is sleeping at this moment, this person is awake at this moment, this person is laughing at this moment, this person is thinking at this moment. But that EEG of the brain cannot tell you that this is exactly what is happening, or this is why this person is laughing, this is why this person is doing like this is why this. It cannot tell you. So it's in the thought, it's in the mind. So a mad person need more of counseling and therapy. Maybe just few medication like a cognito. If the person is having a cognitive problem, the person is finding it difficult to remember, the person is losing memory, the person may need something like tap cognito or paracetamol. If the person is losing coordination, you don't know when you are naked, like you don't know when, like you will be naked, you won't know you are losing coordination. The person may be needing something like paracetamol, tap paracetamol. Or if the person is